This is the AHRMM Subject Matter Expert Podcast, hosted by Justin Poulin. Tune in every month as we speak with industry experts to highlight success stories and solutions from the field that advance the healthcare supply chain. And now, Justin Poulin with this month's expert.
Welcome to the AHRMM Subject Matter Expert Podcast. I'm Justin Poulin, host of the Power Supply Podcast, and with me today is Ryan Burke, VP of Strategic Sourcing at the Pandion Alliance, and we're going to be talking about YPAC, and that stands for Young Professionals Advisory Council. And if you're out there between the ages of 18 and 35, or you have somebody on your team that you would like to get involved in this, we're going to tell you why you should today. And so, Ryan, welcome. Really excited to have you on to talk about this important AHRMM group of individuals that are forward thinking and really the future of supply chain.
I appreciate it, Justin. Thanks so much for giving me the opportunity to jump on the podcast today.
So, Ryan, let's talk about your background specifically and also how you got involved with YPAC.
Happy to. So I spent the first 10 years of my career really on the provider side or the hospital side of the healthcare supply chain, working in various roles from really transaction roles as a buyer to a materials manager role and eventually up to a director of supply chain in my kind of final role at my previous employer. Currently, I've spent the last 4 years or so at a GPO, group purchasing organization, where I lead contracting and strategic sourcing for the GPO. As far as YPAC, I actually applied to be a member of YPAC in 2019 during their inaugural year. I saw a posting on AHRMM's LinkedIn page, thought it was interesting, checked out the application, applied, went through a couple rounds of interviews, and actually was selected to join the YPAC. So I'm so excited to tell your audience all about YPAC, who we are, and what we're looking to accomplish.
Well, we're going to get into that, but what an interesting time to try to kick that all off in 2019, shortly after, I'm sure all of us were pretty busy trying to pivot, I think was the most popular word that everybody chose during that time. But I want to just commend you for still being around as a group and still working together, because that was and is gaining a great deal of everyone's attention. And the back orders continue today, and all the challenges that we faced have not completely resolved themselves. Neither has sort of the financial crisis that everyone is in. And yet this group thrives. So that usually is tied to great mission and great passion amongst the members of the group. Why don't you tell us, what is YPAC exactly? I know I teed it up a little bit, but who can be involved?
Yeah, happy to. So I want to touch on your comment about us being a team and really gelling during the pandemic. Like other organizations, we had to go virtual. We had to meet over Zoom and Teams, and we're able to continue that. And being such a cohesive group, we were able to network together and problem solve in real time. What are you doing for gloves? What are you doing for masks? What's your burn rate? How are you calculating your burn rate? All those important things that were very real during COVID. Being part of the YPAC, you're really part of a greater network of healthcare supply chain professionals. So that was invaluable as we worked through the pandemic.
So it was the best time to start such a group.
Exactly. We couldn't have started at a better time. So as far as the YPAC, the overarching purpose is to connect and engage with young professionals. So when we define young professionals as anyone who's under 35, 18 to 35, I think is that sweet spot. And admittedly, I'll be aging out of that here in the next year or so. And we also target students. So whether they're in colleges or universities, or perhaps they're currently working in healthcare and they're going back to school, and perhaps they want to look at a career in healthcare operations and supply chain. That's really our target audience for the YPAC. And as a YPAC, our goal really is to advise those young professionals about AHRMM, the programs that AHRMM offers, from their educational webinars to the annual conference and exhibitor showcase to their educational materials that they publish, to their policy and their advocacy work that they do. And really, what we want to do is we want to get young professionals and excited about supply chain and working in the healthcare supply chain.
Well, that's really important because there are lots of supply chain jobs out there. They're not all in healthcare, right? We all know that. And I think one of the common ingredients for people who have a career in healthcare supply chain, and honestly, even on the clinical side of the house within the organization or in other administrative roles, is really that passion and aligning with the mission of healthcare and knowing that you're making a difference. I'm assuming that that's a big part of the conversation too, is helping people grow so that they feel like they're learning and doing a better job, but also different from other industries, helping them understand that what they do really makes a difference and has an impact on people's quality of life.
Yeah, and that's really important. Educating young professionals that when they're in that frontline role or they're in that corporate function, perhaps they're feeling stressed, they're feeling overwhelmed, they can't see the work, they can't tie the work they're doing to the greater mission. That's part of the work that the YPAC does. We share stories about how the work we do impacts patient care, impacts our communities. So you're exactly right. That's critical to getting students and young professionals interested into the greater mission of the healthcare supply chain.
And I would think also that positions them to stay in healthcare supply chain longer as well. Retention has to be a big part of it. And what is the value to the YPAC members? I mean, you mentioned students, so you have to have a pretty broad range of people with, maybe 1 year of experience all the way to still having maybe 10 years of experience, different levels within the organization. So you're really appealing to a broad group of individuals with YPAC. What is that value to them? And kind of going back to senior leadership that may be, over 35 and leading their organization, why should senior leadership be aware of the group and the value it can bring to their organization by having those young professionals involved?
Yeah, for the young professional, it's all about the networking. It's all about being able to collaborate with your peers and your colleagues across the healthcare supply chain. So currently on the YPAC, we have provider members who work in hospitals. We have representatives like myself on the GPO who are affiliate members who are bringing a different perspective. And we also have industry partners that collaborate with the YPAC. So you're really getting the entire spectrum of healthcare and the healthcare supply chain. And it's really just good to get that group of people together to solve problems and to talk about things from kind of a young professional's what are you seeing perspective. Related to the question about senior leadership, because the YPAC is so focused on attracting young people into healthcare, the work that we're doing is critical to retaining that. And every organization right now, whether you're on the provider side, affiliate side, or supplier, is dealing with staffing challenges. And so by building up the network that we have through the YPAC, we're creating a little bit of stickiness with this talent pool and with this group of people. So even if they don't stay within perhaps the provider side and they want to go to work at an affiliate or they got to work at a supplier, they're still going to be within the healthcare supply chain network. So they'll understand the points of view that the provider has in taking care of the patient. They'll be able to understand if they go work for a GPO or if they go work for a big medical device or pharmaceutical company. And it's all about that connectivity and networking.
That's a really good point that I hadn't thought of. But if they do go to, like you said, a company or a group purchasing organization, that knowledge and that experience is going to help them serve the healthcare organizations much better as well. And honestly, I feel like there's not enough knowledge about healthcare supply chain out there. And maybe that was exposed, over the last 4 or 5 years, especially. Let's talk about success stories, and I know these are quick hitting interviews, but can you tell us a great story from the Young Professionals Advisory Council that really highlights, the good work that's being done?
Sure. I'll tell you the 2 things that I think the YPAC is most proud of to date. So we host quarterly webinar series. They're called More Than Just Supplies. They're on all sorts of topics, from building a resume to how to interview to hearing from seasoned supply chain leaders and what questions you should be asking your supply chain executives. And we host those quarterly through AHRMM. I encourage your listeners to attend. They're a great event. Also, YPAC has responsibility for a sponsored event at the national conference. And our most successful event to date was something called Lunch with the Boss, where we have executives around the table and young professionals that have the opportunity to have lunch with supply chain executives. So if you think about the provider organization you work at now, it's probably very hard to find time with your chief supply chain officer. Well, if you come to the AHRMM conference and you attend the YPAC lunch with the boss and lunch and learn session, you'll have the opportunity to meet with several chief supply chain officers, all within a casual lunch type setting. It's a great opportunity for young professionals to go and learn and ask those probing and innovative questions about supply chain and about healthcare supply chain, and really learn from experts.
Yeah, I think getting that broader perspective, and you hear people say this all the time, you create this path and you should know, you should have the destination in mind. So it's really important to hear from, seasoned senior leadership, because if you're trying to create that destination in mind for your career, you ought to know more about where you're going, even if you don't have that experience and knowledge yet. So having that access is so critical. I want to just put it out there. This went very quick, Ryan. How can folks learn more and get involved? And I'm actually not just speaking to young professionals. I'm speaking to those senior leaders. I'm speaking to those affiliates and maybe even the vendor or supplier partners that can help the growth of YPAC.
So folks can check out the AHRMM website. A link to the YPAC is listed under the Get Involved tab. Or you can reach out to anyone at AHRMM, staff, and certainly any members of the YPAC. If you want to find us on LinkedIn or through social media, we're happy to connect with you. We're happy to help you get involved with YPAC.
All right, Ryan Burke, VP of Strategic Sourcing at Pandion Alliance. Ryan, great job. Thanks so much for coming on.
Thank you so much for the time.
Thank you for listening to this episode of the AHRMM Subject Matter Expert Podcast. For additional resources, visit our website at ahrmm.org. That's AHRMM.org. Tune in next month for another edition of the AHRMM Subject Matter Expert Podcast.